aking phone calls from a 90-year-old woman you've never met is not typically in a co-founder's job description. But for Marius Čiuželis, it's all in a day's work. In 2016, he and his wife, Kristina, started Sidabrinė Linija, or Silver Line, a non-profit that offers free support to isolated seniors in Lithuania through regular phone calls with a befriender matched to their interests. On the first day, we spoke for 10 minutes. The next time, we spoke for nearly an hour, and she shared a lot about her life with me, recalls Čiuželis from his office in Vilnius, Lithuania's capital. Her husband of 50 years died about 6 years ago, and she has no children. She is completely alone and in poor health. A social worker visits twice a week, but otherwise she is basically locked in her house because she can't move. Čiuželis says they discuss what bread she likes to eat and what kind of dessert he could bring if he ever visited her. She's an extremely lonely woman who just wanted someone to talk to, like many elderly people who don't necessarily want to talk about big philosophies, just day-to-day things, rather than listen to the radio or watch TV all day. Marius Čiuželis, who co-founded Sidabrinė Linija with his wife, Kristina. Photo courtesy of Sidabrinė Linija. Sidabrinė Linija, which has befriended 6,000 seniors since its inception, has been just one of the many pieces of the puzzle to reduce Lithuania's suicide rate, which is particularly high among senior citizens due to a combination of isolation and a culture of keeping mental health issues bottled up. Senior suicides, according to Čiuželis, account for more than 39% of all deaths of this type. We may say it's a natural problem that your support network shrinks when you get older. But let's imagine the couple who lived happily for 50 years and now one has gone. We get many calls saying, I tried to do my best to live on my own, but I can't anymore and I need help. We have many callers who say they call us as a last chance, says Čiuželis. In Lithuania, Čiuželis explains, asking for mental health support is still viewed with shame, particularly for older citizens who experienced Lithuania's Soviet rule from the 1940s to 1958. Economic and political instability followed, which caused higher levels of unemployment, inflation, and poverty.
Weighed down by negative news.
Our smart, bright, weekly newsletter is the uplift you've been looking for. Many of those people are afraid that if they see a psychologist, especially if they live in a small, rural area, everyone will know their personal problems, says Čiuželis. The alternative is they are given a prescription for medicine, but it's not what they need. We feel it's important to encourage them to open up and talk, and once we build trust, we can refer someone to professional support if needed. Sidabrinė Linija has received funding from the Lithuanian government as part of mounting efforts over the past 20 years to recognize the drivers behind the country's high suicide rate and move away from a culture of hiding problems toward one where it's okay to talk about them openly. When Lithuania joined the EU in 2004, it recorded a suicide rate of around 44 per 100,000 residents, and it became consistently known as having the highest suicide rate in the region. Since then, it has worked to reduce its suicide rate, which is now at 19.5 people per 100,000. It's been a long process with many steps along the way, but the tide is now turning. In 2015, the Lithuanian government published its first national mental health strategy, followed by the launch of its Suicide Prevention Bureau in 2015 and a Suicide Prevention Action Plan in 2016, with an emphasis on providing more community-based services and shifting away from an overly medicalized approach. A national suicide prevention algorithm was launched in 2018 across all medical and social services to more easily identify at-risk individuals and offer specialist supports. Last year, this algorithm led to 600 people receiving a full package of mental health support services and 200 undergoing comprehensive assessments, which is not insignificant in a country of just 2.9 million people. Another cornerstone of Lithuania's campaign against suicide has been its mental health ambassador program. Launched in 2018, this initiative has deployed volunteer ambassadors across the country, leveraging their personal stories of seeking help when feeling suicidal to effectively change attitudes and behaviors around mental health. Sidabrinė Linija volunteers. The non-profit has befriended 6,000 seniors since its inception almost a decade ago. Photo courtesy of Sidabrinė Linija. Accessible mental health support more generally is also expanding nationwide. Since 2020, free psychological well-being services have been available at centres in every one of Lithuania's 60 municipalities, providing drop-in access without a doctor's referral. These centres serve over 30,000 people annually, addressing issues such as stress, depression, and anxiety, with the aim of offering support early, before someone's mental health issues escalate into suicidal thoughts. Beyond direct mental health interventions, stricter alcohol control laws have played a part. In Lithuania's Soviet past, a culture of heavy drinking to numb problems rather than address them became normalized. Tackling this has been crucial as alcohol abuse correlates strongly with the high-risk groups for suicide in Lithuanian middle-aged and older men in rural areas. We do have a lot of mental health problems compared with other countries, so we need unique solutions to solve them, says Ignas Rubikas, head of the Lithuanian government's mental health division.
Lithuania is in a position where mental health diagnoses are rising fast, adds Rubikas, so developing the right number and assortment of services to meet this demand has been key.
We have now destigmatized mental health so much that our specialists are becoming overworked.
But I think that's a good sign that we're acknowledging and accepting the problems and that we have taken the first step towards solving